Hello, my name is Kristi Eustice. I'm a senior research analyst at Morrison Institute for Public Policy and one of the 2022 Town Hall Report editors. For those of you who are not familiar, Morrison Institute is a nonpartisan public policy center located in Arizona State University's Watts College for Public Service and Community Solutions. As an institute, we analyze important policy issues to advance public understanding in Arizona and beyond, develop tools and resources that help communities make informed decisions, and provide forums to engage with public policy research. I'm here today to provide an overview of the 2022 Town Hall Report on mental health, substance use, and homelessness, including why this topic was chosen, our intent and approach to compiling the report, and the report structure. Then I'll end by highlighting some of the innovations around the state that are addressing this complex topic. Mental health, substance use, and homelessness was selected by the Town Hall Research Committee as the report topic because of the challenges and broad sweeping impacts associated with the intersection of these issues. At the time of compiling the report, the 2020 point-in-time count was the data available to us. And at this time, there were nearly 11,000 people experiencing homelessness in Arizona. Nearly 2,000 people had chronic substance use, and more than 1,500 people were designated as having a serious mental illness. It's important to note that these numbers are undercounts, given that the point-in-time count is conducted on one single day a year by volunteers. Now, this is an incredible effort and a critical data point for understanding homelessness in our state. And at the same time, it's important to recognize the limitations of this method. Additionally, this number does not include people who are marginally housed. So those are folks who may be living with family, living doubled up, or in substandard conditions. Adding these individuals propels the estimate to nearly 44,000 people. That is well over twice the number of people it takes to fill the Phoenix Suns arena. In February of 2022, an updated point-in-time count was released. The unfortunate reality is that we saw an increase in homelessness across the state. In Maricopa County alone, the count increased by 22%. Additionally, there were hundreds who responded to the survey and indicated that their homelessness was caused by the COVID-19 pandemic. Moreover, the effects of mental illness, substance use, and homelessness ripple across our communities and neighborhoods and impact more than the individuals experiencing them. Their impacts on the social service systems, emergency and health systems, and the criminal justice system, as well as on local economies and public spaces. Then there are the mental and emotional tolls on the individual and their support network, as well as financial consequences for families, communities, cities, and the state. In sum, this topic was chosen for its relevance because these issues and their intersection are likely to touch all Arizonans in one way or another. Approaching the report, there was a collective effort to produce a document that is focused, fact-based, descriptive, and representative. Focus meaning that to the extent possible, content is focused on that unique intersection of mental illness, substance use, and homelessness. Fact-based, meaning content is supported by data and literature or grounded in an author's lived experience. We encouraged authors to include experiential knowledge because not only is it valuable, but in many cases, it's the only information available. Descriptive, meaning the content explains the issue and does not advocate for one approach or position. And representative, meaning the report includes statewide data and perspectives. Authors are experts from various service delivery organizations, government agencies, and academic institutions across the state, including rural Arizona. Here's a snapshot of the report content and structure. The report begins with a comprehensive overview of mental illness, substance use, and homelessness, and their intersection. The authors then provide an overview of integrated treatment and care in Arizona, structural factors that produce and perpetuate the issues, and options for recovery and stabilization. The report concludes with 10 spotlight chapters, focusing on specific populations who are disproportionately or uniquely impacted by the intersection of mental illness, substance use, and homelessness. Although these issues can and do impact anyone, we recognize that not all people are impacted equally and in the same way. For example, we know that our unhoused community is aging. Over half of people experiencing homelessness in Arizona are over the age of 50. We know that African Americans are disproportionately represented in the homeless community. While African Americans comprise only 5.7% of the population in Arizona, They represent 21% of people experiencing homelessness. We know that previously incarcerated individuals are especially vulnerable because people who have been incarcerated experience homelessness at rates 7 to 13 times higher than the general population. And these are only a few examples. So we hope you'll spend some time exploring the report and that you'll share it with others who want to be involved in these conversations. We hope you walk away with a tool for conversation and decision-making and an idea of some of the incredible work being done to address these issues. I will leave you with just a few of the amazing innovations that are discussed in the report. In Flagstaff, they have an alternate response team, which stemmed out of a collaboration between the city and Taros Health. This provides a new police response option for nonviolent calls. If a call comes in related to mental health, substance use, or other nonviolent distress, the dispatcher may choose to send an alternate response team, or ART, which consists of an EMT and social worker. This not only allows the person experiencing distress a better opportunity to receive the appropriate level of care, but it also allows the police to focus their energy on violent crime. The Transitional Living Care Program from the Regional Center for Border Health provides transitional housing and services to people in rural Arizona. The program started in San Luis and Somerton and is being expanded to Parker. The program lasts 6 months and is free of charge. At the time of the report, 70% of previous clients had found employment and 65% had secured independent housing at the time of the program being completed. Pathways Home is a great example of a regional coordination effort to address homelessness. This is a regional homelessness action plan for local and tribal governments that was created out of 14 months of engagement with cities, towns, counties, tribal governments, nonprofits, and service providers. This collaboration allows for a regional response to remove barriers to exiting homelessness, increase access to services, and coordinate policies and guidelines. Senate Bill 1376 was passed in July 2021 and requires that mental health instruction be included in school curriculum. Content is developed by the Department of Education with consultation from mental health experts with the goal of enhancing students' well-being through social and emotional learning and an increased understanding of attitudes and behavior that promote health and well-being. And you can find many more examples like these in the report. Lastly, I want to extend a sincere thank you to the report authors for contributing their expertise, time, and energy towards this critical resource. I also want to thank you for your interest in this topic and for being here. You may download the full report from the Town Hall website, or you can use the QR code on this slide.